If you haven't heard it before, you may hear someone say it in the future. High blood pressure is a silent killer. Jeff discovered this on his path to learning the symptoms of high blood pressure after a doctor gave him a surprise diagnosis and prescribed him medications that may lead to side effects. He wondered, what happened and how did I get here? Then came the desire to learn more about blood pressure and what medicines can help or harm. What is blood pressure? Every time your heart beats, it forces blood through your circulatory system, the extensive network of arteries and veins throughout your body. When your heart contracts and forces blood through the narrow tubes of your arteries, it creates pressure in your blood vessels, known as your blood pressure. This can naturally happen during activities such as exercising and playing basketball, and it can even happen naturally when you're under stress. When your heart relaxes, the pressure in your blood vessels drops. However, if the pressure in your blood vessels is high while you're resting, this may be a sign of high blood pressure, also known as hypertension. Your blood pressure measurement includes two numbers, one representing the maximum blood pressure during heart contraction and one lower number representing the minimum blood pressure when your heart relaxes, measured in millimeters of mercury. These numbers are your systolic and diastolic blood pressure, which can be seen on a blood pressure monitor. The number on top is your systolic blood pressure, which measures the maximum pressure your blood is pushing against the artery walls when your heart beats or contracts. The bottom number is your diastolic blood pressure, which measures the minimum pressure your blood is pushing against your artery walls while the heart muscle rests between beats or relaxes. For example, your blood pressure reading may show 120 millimeters of mercury, systolic blood pressure, over 80 millimeters of mercury, diastolic blood pressure. So what is a normal and healthy blood pressure reading? According to the American Heart Association, a normal blood pressure reading is less than 120 millimeters of mercury systolic over less than 80 millimeters of mercury diastolic. In some cases, blood pressure may be too low, so your heart, brain, and other vital organs may not get enough blood. If your blood pressure drops below 90 over 60 millimeters of mercury, you have low blood pressure or hypotension. Because your body and brain are not getting enough oxygen, low blood pressure may make you feel tired, dizzy, lightheaded, faint, confused, weak, or nauseous. It can also cause headaches, blurred vision, back and neck pain, and heart palpitations. In severe cases, low blood pressure can cause shock. If your skin feels cold and clammy, your pulse is fast but weak, your skin turns blue, and your breathing is more rapid, get medical help immediately. Be sure to check your blood pressure and talk to your doctor if you have concerns about low blood pressure. So what about high blood pressure? What is high blood pressure or hypertension? Let's look at the blood pressure chart again. You can see there are different stages of hypertension. These stages may exhibit various levels where the blood does not flow normally due to dysfunctions like stiffness of the arteries or clogging of the arteries with fatty plaques known as atherosclerosis. First, your blood pressure is elevated if it falls between 120 and 129 over less than 80 millimeters of mercury. Next, you have high blood pressure or hypertension stage 1 when your blood pressure reading is between 130 and 139 over 80 to 89 millimeters of mercury. The heart is forced to beat more strenuously to overcome the restricted blood flow through the arteries. Now the blood is pumped at high pressure and eases possible problems for functions of the brain and kidneys due to lack of blood. However, in some people, the adjustments become fixed, thereby leading to hypertension. When your reading exceeds 140 over 90 millimeters of mercury, you have stage 2 hypertension. When your blood pressure readings are consistently high and your doctor diagnoses hypertension, they may advise you to eat a diet low in salt and high in fruit and vegetables, do regular physical activity, and prescribe an antihypertensive drug, also known as blood pressure medication, which may come with side effects. Finally, If your blood pressure goes higher than 180 over 120 millimeters of mercury, you are in a hypertensive crisis which requires immediate treatment. Two types of hypertensive crisis require immediate attention. Suppose your blood pressure is 180 over 120 or greater, and you are experiencing warning symptoms such as chest pains, shortness of breath, back pain, irregular heartbeat, numbness, change in vision, or difficulty speaking. In that case, you are in a hypertensive emergency. Call 911 immediately. If your blood pressure is 180 over 120 or greater and you are not experiencing warning symptoms, take your blood pressure again. If the reading is still high but you have no symptoms, you are in a hypertensive urgency. Consult with your doctor immediately. You may need to adjust your medications, but you should call your doctor for advice about changing your medications and proceed to the hospital. Hypertension often goes unnoticed. Checking your blood pressure is the most common way to know if you have it. However, these are some of the symptoms if there is a hypertensive crisis, which is a medical emergency caused by a sudden severe increase in blood pressure. Chest pain, abnormal heart rhythm, difficulty breathing or shortness of breath, severe headaches, dizziness, anxiety, confusion, blurred vision or other vision changes, buzzing in the ears, nosebleeds, nausea, and vomiting. Interestingly, many people experience a natural increase in blood pressure upon waking, which is known as the morning surge, which could put someone with hypertension unknowingly at further risk. Blood pressure naturally exhibits a circadian rhythm that dips at night during rest, undergoes a steep increase in the morning, known as the morning surge, and may peak in the late afternoon. Morning hypertension or the morning blood pressure surge is an important aspect of hypertension research because it's been reported that hypertensive cardiovascular risk is the highest during the morning surge. This risk is characterized by the highest incidence of major cardiovascular events, including myocardial infarction, sudden death, or stroke. And the risk may be even higher when residual nocturnal or nighttime hypertension is present. Certain medications, health conditions, and lifestyle choices can influence the morning blood pressure surge as well. So understanding the timing of monitoring your blood pressure while tracking any influences can make a difference in your well-being and treatment. Ask your physician about ways you can better monitor your blood pressure and any influences or risks like medication side effects. Your doctor can tell you if an irregular daily blood pressure pattern needs treatment and recommend any lifestyle adjustments to help keep you in better shape. They may recommend an ambulatory blood pressure monitor that tracks your blood pressure over a 24-hour period to provide greater insight into blood pressure results. High blood pressure risk factors include age, ethnicity, family history, having obesity or extra weight, sedentary lifestyle, smoking and vaping, drinking alcohol, a poor diet high in salt and low in potassium, stress, chronic health conditions, certain medications, and pregnancy. Alternatively, symptoms of low blood pressure or hypotension may include weakness, sleepiness, blurry vision, confusion, dizziness, fainting, lightheadedness, nausea, or vomiting. Causes of low blood pressure could be standing up too quickly, severe blood loss, Parkinson's disease, heart failure, drugs for hypertension, dehydration, medical disorders, and certain medications including some anti-anxiety drugs, antidepressants, diuretics, heart medications, painkillers, and post-surgery drugs. If you experience these, contact your doctor to learn more about possible treatments and side effects, and be sure to ask about alternatives. Even if you have normal blood pressure, some things may cause a sudden spike. They include drinking coffee or other beverages that contain caffeine, anxiety or stress, severe pain, medications such as those used to treat the symptoms of colds and flu, a poor night's sleep, and dehydration. Knowing if you have high blood pressure is critical because it can affect several body parts. Uncontrolled high blood pressure over long periods can lead to serious medical conditions, such as heart failure, a heart attack, kidney disease, vision problems, or a stroke. What is a stroke? High blood pressure in the arteries damages the artery walls, increasing the risk of blockages and burst vessels. When this happens in the brain, it is called a stroke. In 2021, 1 in 6 deaths from cardiovascular disease was due to stroke. The part of the brain affected by the lack of blood flow and oxygen begins to die, affecting your ability to talk, think, and move. To help you spot the most common signs that someone may be having a stroke, follow this acronym. B FAST. B stands for imbalance awareness. E stands for eyes or vision check. F stands for face drooping. A stands for arm weakness. S for speech difficulty. And T stands for time to call 911. Since hypertension may be asymptomatic, blood pressure is usually measured using an arm cuff, also known as a stethoscope, or electronic blood pressure monitor at all doctors' consultations. To measure your blood pressure at home using a blood pressure monitor, sit upright and relax with your arm resting at the same height as your heart. Place the deflated cuff over your upper arm and press the machine's start button. The cuff will inflate, temporarily closing off the arteries in your arm. The pump will stop once the pressure is higher than your systolic pressure. The pressure is then slowly released when blood starts flowing again. The machine registers your systolic blood pressure, and when blood flow can no longer be detected, your diastolic blood pressure will be recorded. Once complete, the blood pressure monitor will give you a reading of your diastolic and systolic blood pressure. High blood pressure treatment. Treatment for hypertension involves long-term management to control your blood pressure. Your doctor may recommend that you eat a low-salt diet that provides plenty of potassium from foods like fruits and vegetables. Maintain a healthy weight. Exercise regularly. And avoid alcohol and smoking. You may also be prescribed medications to lower your blood pressure. There are various types of blood pressure medications, including different drugs with benefits and risks that you should be aware of. The 9 major classes of blood pressure medications are: Number 1 is diuretics, which help control blood pressure by eliminating excess sodium and water. They're frequently used with other blood pressure medications. Possible side effects of diuretics include potassium loss and electrolyte imbalances, dehydration, hypertension, increased risk of high blood pressure sugar levels in diabetics, erection problems, and gout. Number 2, beta blockers. Beta blockers lower heart rate, workload, and blood output to reduce blood pressure. They're often prescribed to patients who have coexisting heart diseases or arrhythmia. Possible side effects of beta blockers include insomnia, constipation, dizziness, slow heart rate, fatigue, cold extremities, cough, asthma, and sexual or erectile problems. A third medication class commonly prescribed for blood pressure is angiotensin-converting enzyme inhibitors, also known as ACE inhibitors, which reduce the production of angiotensin, a hormone that causes the narrowing of the arteries. This helps blood vessels stay open, lowering blood pressure. Doctors usually prefer this class for patients with heart failure and chronic kidney disease. Possible side effects of ACE inhibitors include dizziness, fainting, high blood potassium, dry cough, low blood pressure, and kidney damage. ACE inhibitors should not be used during pregnancy because they can be dangerous to the mother and baby. Another blood pressure medication class is angiotensin II receptor blockers, ARBs. ARBs block the effects of angiotensin, a hormone that causes the narrowing of the arteries. This helps blood vessels stay open, lowering blood pressure. More specifically, ARBs prevent angiotensin from binding to receptors, which prevents the hormone from narrowing your blood vessels and causing high blood pressure. These medications are often chosen for patients with heart failure, chronic kidney disease, or who are experiencing dry cough as a side effect of ACE inhibitors. Possible side effects of ARBs include dizziness, kidney damage, low potassium, and too low blood pressure. It should not be used during pregnancy as it is dangerous to mothers and baby. At number 5, we have calcium channel blockers, which assist in preventing calcium from entering the heart and arteries muscle cells. Calcium causes your heartbeat to beat faster, pumping more blood and causing your blood vessels to tighten. Blocking excess calcium from entering the heart and vessels can slow down the rate of blood pumped and your blood pressure. Doctors tend to choose this treatment for elderly patients and those with coexisting heart diseases. However, calcium channel blockers may have side effects, including ankle swelling, slow heart rate, constipation, headache, and dizziness. The next class of blood pressure medication is alpha blockers. Alpha blockers relax the muscle tone of blood vessel walls, helping blood vessels stay open and lowering blood pressure. Doctors often choose alpha blockers for patients with benign prostatic hyperplasia, BPH. Possible side effects include fast heart rate, dizziness, low blood pressure, nasal congestion, weakness, and trembling. Alpha-2 receptor agonists are the next class of medications which decrease sympathetic nervous system activity. Doctors may prescribe when other classes are not well tolerated. Possible side effects include drowsiness and dry mouth. The 8th class of blood pressure medications is medications that combine alpha and beta blockers. This class is commonly used for patients having a hypertensive crisis or for patients at risk for heart failure. Possible side effects include a drop in blood pressure when standing up, fatigue, and low heart rate. The final commonly prescribed class at number 9 is blood vessel dilators, vasodilators, which relax the muscle tone of blood vessels' walls. This helps blood vessels stay open, lowering blood pressure. It usually reserved for emergencies such as heart failure, angina, also known as chest pain, or when other medications are not well tolerated. An example of a vasodilator drug called hydralazine may cause possible headaches, swelling around the eyes, flushing, heart palpitations, low blood pressure, and joint pain. Another less used vasodilator drug, minoxidil, may be prescribed by a doctor when other drugs are not effective for severe hypertension. Minoxidil may cause fluid retention and the condition hypertrichosis, which is excessive abnormal hair growth in unusual areas of the body for men and women. Being aware of side effects is really important. Weighing and understanding your options can impact your quality of life. Remember, medications can cause side effects, and they are not the only option for managing your hypertension. There are natural ways to help lower blood pressure. If you have experienced a blood pressure spike, you can help reduce blood pressure with stress management techniques, including meditation and deep breathing. Research suggests these holistic approaches to health can significantly improve blood pressure, heart disease risk, and quality of life. Studies show that a diet low in salt and high in fruit and vegetables, including plant-based diets such as vegetarian or Mediterranean diet, can lower blood pressure and reduce the risk of heart disease. Research indicates that specific foods can help lower high blood pressure, including olive oil, high-fiber vegetables, fruits and seeds, omega-3 rich salmon, chia and flax seeds, high-magnesium bananas and avocados, ginger, garlic, pomegranate juice, spinach, coriander, cardamom, green tea, and beetroot juice. Studies on supplements show that L-arginine, coenzyme Q10, fish oil, omega-3 fatty acids, and magnesium help reduce high blood pressure. Be aware that some supplements may interact with certain medications, including blood pressure drugs. Consult with your healthcare practitioner before adding supplements to your routine. Lastly, weight management and physical activity are essential to naturally preventing and reducing high blood pressure. Studies suggest people with obesity and excess weight have a high rate of a phenomenon called resistant high blood pressure, which is when high blood pressure does not respond well to aggressive treatments, such as medications. Regardless of taking multiple medications, even at higher doses over the recommended amount, high blood pressure medications are resistant to treatment. So weight loss, maintaining a healthy weight, and daily exercise can help lower the risk of high blood pressure and worsening of this condition. Click the link below to learn more and discover ways to improve your blood pressure. MedShadow is a nonprofit organization independent of pharmaceutical companies. It was created to help protect our health, our families, and ourselves from medical harm, including the side effects of medication, by providing informative videos like this. Like, share, and subscribe for more health videos. And learn more about symptoms, conditions, and side effects at medshadow.org.